Well, good morning. Come on, Buffalo, a little stronger than that. You got to know that you're awake. Well, I woke up this morning, and I learned recently, in the last several years, I've been teaching over at Damon College, that the young people don't read the newspaper, but I still do. And we made the front page. Scott Scanlon did an article about the Robert Wood Johnson County Health Rankings. And for those of you that may not be familiar with those, for the last 10 years, the Robert Wood Johnson Foundation is the largest foundation in the United States devoted to improving the health of the American population. And they take a multi-pronged approach to that. They not only look at the treatment and cure side, but very strongly at the prevention and health promotion side. And while the results that are reported here today are trending in the right direction, I think all of us know that we're not where we would like to be in terms of our health status. So what John Craik, who I'm going to bring up here in a minute, my colleague and friend, what we thought we would do today is give the community a look at and a response to the county health rankings. And this is regional in scope. It's not just Erie County. The Population Health Collaborative serves the 8 counties of Western New York. But we wanted to highlight several of the good things that are happening that are moving us in the right direction. And so I want to bring John Craik up here. He's the CEO of the Western New York Population Health Collaborative, and he's got a couple of exciting initiatives and information to share with you. So John, you want to come on up, please?
Thanks, Phil, and it's always tough following Phil Haberstroh, who's the Dean of Population Health in Western New York. I think Phil's been doing this work since the war, the Civil War, but good for you. The numbers are really a little bit misleading and frankly more than a little unfair, because if you dig deep in terms of what they're measuring, it's really about chronic disease. So things like obesity and diabetes and cardiovascular disease. And these are the types of diseases that are not going to change overnight, and certainly not in the course of the year. So again, we think that the trends are going to move more rapidly in better directions over the years to come, and it takes a long, long time to get there. We have some things going on, and I say we, including a lot of people in this room, Phil and the people standing behind me, and a large coalition, taking, frankly, a really new and we think very exciting and transformational approach to changing the health of Western New York. So if you think about what affects people's health, particularly things like obesity, diabetes, cardiovascular disease, depending on who you ask, the clinical care accounts for a small percentage of that, between 10 and 20%. If you think about how often you see your doctor compared to how often you're at work or school or in church or in your community at home, you're really not getting the type of activities in the doctor's office that's going to have the impact on your health that you are outside of the doctor's office. So with Phil and, again, a large group of other partners, we're working with economic development leaders, education leaders, leaders in community development, and leaders from all these other sectors that for too long have been left away from the population health table. And by bringing them all together and embracing the same mission, the same measures, the same language, and just a few really, really doable, achievable goals, we're very confident that over time we're going to see these rankings improve dramatically. And we look forward to the day when Western New York is one of the more healthy regions of New York State. The other thing, stay tuned, because within a few months we are going to release a report that shows the economic development burden of our chronic disease problem. One of the things we really, really need to do as a community is rally the private sector, the employers, and the business leaders around caring for population health. Again, a lot of the other sectors, the United Ways, community-based organizations, education leaders recognize this is a problem, and they recognize that there are certain things we need to do about it. Employers have been glaringly absent so far, but we're going to issue a report that we've commissioned that will show what we think will be an extremely high burden of our chronic disease problem in Western New York, and we hope we'll use that as a rallying point, excuse me, to bring more business leaders to the table. So we've got a ways to go, and there's no getting around that, but we're doing the right things, and frankly, for the first couple of years, we're really getting everybody involved in doing the right things. So we're very, very excited to see what's going to happen in the near future. So fasten your seat belts and stay tuned, because we plan on having more good news in the future. Phil, I think I'm turning it back to you.
Thank you, John. So when this report has come out in past years, many of us have been contacted by the media, and they ask us, why? Why is our health status not so great, and so on and so forth? And anybody got any chicken wings out there in the audience? So some of it can be nutrition-oriented. You can look at a community culture very deeply, and you can see there's a recognition today that if you tell a person and you ask a person what their zip code is, that you can probably give a good prediction of their health status. One of the things that we want to do, though, is just address that issue of why and how we think we're going to be able to move forward. And one of the key elements, I think, is that we're beginning to understand that we need to be strategic in what we're doing. We need to go upstream. And so I'm very excited about what John and his team are doing for the entire region. They're going to be launching the Live Well Western New York initiative. We have championed the World Health Organization's Ottawa Charter for Health Promotion. These are very similar documents in the context that they look strategically. They look at policy. They look at environmental aspects. John mentioned the collaboration that we're doing across sectors and an interdisciplinary approach to improving the health of our communities. I think the flaw in the past has been that there's been a dependency on just doing programs and not taking a comprehensive approach. And another part of that whole framework, of course, is the idea that our citizens get involved. In the audience here today, and I'd like her to come up to the front too, because I will ask her to say hello, is Jackie James Creedon. Jackie, I know you're out there if you want to just come on up and join us. I'd like a round of applause from the group. Jackie is the woman who was the champion of the efforts in the northern part of Erie County to address the air pollution issues that were there. It's a long story. It's a 15-year story that she has gone through with her group, and there's a number of other citizens that have helped her, including the elected officials in the city of Tonawanda, town of Tonawanda, and Grand Island. But I think it's a very clear example that we at the grassroots, that citizens coming together using our democracy can bring about positive change. So I want to just stress that we're taking a strategic approach to what we're doing in the future. And I want to ask John to come back up and just speak a little bit about some of the social capital building and the collaboration that he's seen over the last couple of years.
Yeah, and so I'm glad that Phil mentioned programs, because it's become a cliche where I work, and my staff rolls their eyes, but I say it over and over because it's true. As a community, Western New York, we're program-rich but systems-poor. So we have a lot of programs. We have a lot of people working very hard on programs. But to the extent they haven't been lined up, really drives the fact that we continue to get not so great outcomes. So imagine if you take your child to the doctor and your doctor says, you know what, your child's already really obese. She really starts to need to exercise more and eat better. And you say, terrific, and you leave the office. A lot of times, nothing's going to come of that. But imagine if then in your school, they got rid of all the vending machines with sugary beverages, and your school had an active recess program. And then in your community, you had access to healthy food that was affordable. A lot of people really don't have access to healthy, affordable food. And your community was built in a way that it was much more amenable to walking. You had sidewalks, you had safe parks, you had all these places for your child to go. All these things coming together in a collaborative way is really what's going to change people's health, more so than the doctor just saying your child needs to lose weight. So we're kind of down the road. There's wonderful efforts already happening throughout the region. Niagara Falls has a wonderful collaboration with a lot of sectors. The Healthy Community Alliance and Healthy Communities Coalition in Cattaraugus County has a huge, very, very robust collaborative alliance, and we're seeing this grow more and more. So as we develop these collaborations around the region, again, we're going to see better outcomes. So again, I keep saying this, stay tuned. Thanks.
Thank you, John. And we would like to just take a moment here and work a little bit through the systems approach that John talked about. And that starts with our youth. And our United Ways have programs to encourage breastfeeding. But I want to bring up to the podium two folks, and I'm going to ask ladies first. I'm going to ask Maisha from Hope Buffalo to come up. She's going to tell you about some efforts that have been made in the city of Buffalo successfully. They've got good metrics on this to reduce teen pregnancy. Maisha?
Thank you. Thank you for this opportunity. Yes, my name is Maisha Drayton, and I work for CAI, which is a nonprofit organization, and we are the anchor organization for Hope Buffalo. Hope Buffalo stands for Health, Opportunity, Prevention, and Education. And I love what John said about being systems poor, because that's what we're working on. It's about bringing and changing the environment in which our young people live, right? And so also having their voice amplified so they can say, this is who we want to be. This is what healthy looks like to me. These are the choices I'd like to make, and also offer support and so that they can make the choices that are beneficial to them. It started as a teen pregnancy prevention initiative. It was funded by Office of Adolescent Health, but as we spoke to our community members, over 40 different collaborations of different sectors came together, including youth. They said that, okay, so we don't get pregnant by 19. At 20, I'm still broke. At 20, I'm still feeling hopeless. What can we do in order to address that? We have to change the environment. So we talked about the social determinants of health. What is happening in our communities? What is happening to our youth? Who are they talking to? Who are they listening to? And what are they saying? If they go somewhere, who's offering them support? Are they trained and to get the best opportunities for our young people? So that's what Hope Buffalo does. And we have great partnerships with people around behind me, next to me, Buffalo Public Schools, our United Way, all the people in this audience. Hi, Reverend Diane. There's so many, Broderick, people who are at the table who are really working hard to change. And so we're excited about what we've done since 2015. Even though our funding was threatened, our community said no. We're going to stay here. We're going to work hard, and we're still moving forward. So I thank you for being a part of this. I'm very proud. I have children, one graduated from BPS, one who's there now. So I'm invested. I live in Buffalo. I love it to the most part. But I'm really interested in seeing it be the best city it could be for everyone. Cranes in the sky, they're for all of us, not just for the few that can afford to be up and looking down. So that's what we're here for, and thank you.
Great. Thank you, Maisha. You know, one of the things I think we all recognize is that fostering community change takes leadership. I talked about Jackie's leadership at the citizen level, but it also takes leadership and vision at the elected officials level. I have two elected officials with us today. One who I've worked with for many, many years. He was instrumental in helping the city of Buffalo pass complete streets legislation. That's legislation that encourages streets not only to be for automobiles, but for bicyclists and for pedestrians also. Later, he moved on into the realms of the New York State Assembly, and he served the 142nd Assembly District. During the time that he was there, I approached my friend, and I asked him, how's your district doing? And he's a people person and a doer, and he thought, well, you know, we're doing okay. And I said, how about we launch the Healthiest Districts Initiative? And he has moved on from the assembly. He is now your county clerk, but his passion, not only for our children, but for veterans and others, shows up in his work. So I'd like to invite our county clerk from Erie County, Mickey P. Kearns, to come up and say a few words about the Healthiest District Initiative. Mickey?
Thank you, Phil. It's an honor to be here today. And it's very important when you're talking about the health and wellness of a community. And when I think back to my Common Council days when I met Phil Habistro from the Wellness Institute, and we were talking about complete streets and walkability, not too many people at that time really understood or wanted to believe that walking would improve a community, would improve the values of homes in a community, that would make the community wealthier. And we're seeing now, and I'm not just saying it's because of complete streets, we're seeing a much more friendly Buffalo when it comes to bicyclists, pedestrians, and walkability. And that's important, as John was talking about, system-oriented. I then went on to the New York State Assembly, and Phil did approach me, and when the statistics released concerning the Robert Woods Johnson Foundation, I have to be honest, I was quite alarmed that we as a community were not faring so well. Every year, if we think about it, we strive to be the best, whether it's to win the Super Bowl or to win the Stanley Cup, or even hopefully UB maybe taking back the title. We're very, very hopeful maybe that could happen. but we really don't talk a little bit about our health and wellness as much as we should as elected officials. And John mentioned something, and Phil knows how important data is. And one of the things I've been able to do is working with Phil, we started something called the Healthy District Initiative, where we're working with the superintendents, the Buffalo superintendent, the superintendent of West Seneca, the superintendent of Lackawanna, and the superintendent of Orchard Park. Kenton joined our group, and of course BOCES, and they're all coming together to help our youth make a decision to be healthier. And there's a discussion. Last year, we did something very simple. We brought people together to the parks to do a park cleanup and to talk about health and wellness in our communities. We are going to do that again. And it was interesting on how successful it was and how the different children were able to go to the different parks. And we thank the state of New York for their cooperation in this matter. I then went on to become the Erie County Clerk. And the one thing I did realize is that we are an office where people come to us. And I think that's a great opportunity. So one of the things we started, and I know people think I was a little nuts when I said this, but we started blood pressure screenings. And when people were waiting, very short time, don't think it was a long time, but when people were waiting short, we were able to partner with Catholic Health System. And in the first year, we were able to help many, many people. And not only were they able to get their blood pressure taken, Catholic Health System provided assistance for them to get a physician. What a great opportunity. We had one young lady who moved in from Rochester. She said, I can't believe in Erie County, I can get my license done, I can get my blood pressure screened, and I can get a physician. They're not doing that in Monroe County. They're not doing that in any county. We had some positive results. Even our employees who participated, we had a few employees that were at the high end of the spectrum that had to leave literally that day and get a health checkup. And we want our employees, obviously, to be healthy because good employees, health employees, are productive employees. Also, Catholic Health and their cooperation working with Mark Sullivan and CJ Erlab from Mercy Hospital, we're so appreciative. They were able to add an additional program with carotid artery screenings. And we know in Western New York, it was mentioned, chicken wings, which I love, and of course other foods that we eat probably on a regular basis. But unfortunately, the data doesn't lie. And we found that 12% of our people that came for those screenings had a high incidence of probability of stroke. And we know heart attack and strokes are the silent killers in Western New York. And unfortunately, I have bad news to tell you today. I wish it was better. When we did our stroke awareness or our screenings this year, again with Mercy Hospital, over 250 people participated. Unfortunately, we found that 50%, 50% of the people we screened for blood pressure had high blood pressure. That's unacceptable when you think about it, especially in areas where we concentrated in downtown among African Americans and Hispanics. It was like pulling teeth to get people to finally come because they were afraid. They were afraid to come up and find out the results. Well, we can't be afraid anymore. We have to have this discussion about health and wellness, and I will continue to do that as the Erie County Clerk. And now we formed, bringing over the Healthy District Initiative, we formed something called the Clerks Wellness Collaborative. I'm very proud of that. I know our legislator is going to talk nuts next. I drive him nuts. I drive the legislature nuts. He's laughing. But I always say I'm never, ever going to apologize for taking my job and bringing good things to the people of Western New York. Something small that we're able to do, you may have noticed, is we took out the vending machines. When you talked, John, about taking vending machines out, and I would go visit the audit bureaus, and I would talk to the employees. I said, well, why do we have these vending machines here? They said, well, they're for the kids, and if they get a candy bar, if they're good. I said, no, we're taking them out. And we're going to be working in the future and working with the county to bring healthy vending machines and fruits and vegetables as much as we can, and as much as we can, working with a partner that will help us do that. So we have to do better because the cost to government is too high when it comes to what we pay. And I would rather use that money in other ways and in a productive way. The final thing I want to say is Phil and all the team here, we have to reach out and make sure and let people know and our elected officials know. We've got great people in the community like the Ralph Wilson Foundation that has taken leadership when it comes to improvement to our parks and our communities. But health and wellness goes beyond other things. And I know we talk about environmental issues. Remember, we have many brownfields in the city of Buffalo and the surrounding community, and it's just important to reach out to your state elected officials to let them know that these programs are so important. These cleanups are so important to make sure our communities, especially our youth, are growing up in communities where they're not only walkable, they're not only friendly, but they're all also environmental, cooperative with the community. The environment is just as important as that. So as your Erie County Clerk, I promise you today that one, I will get you out as fast as possible. Make an appointment, okay? Make an appointment. But number two, when you come in, you're going to see a different Erie County Clerk's office because we want you to be healthy. We want you to be part of the team. And I'm hopeful someday, and it's not going to be a long time, that many of our elected leaders will know how important, and I know the next elected official will talk about this, health and wellness is to our community. 56 is not good enough. It's failing. It's a D. If your kids came home with a 56, what would you say to them? That's great. You went from a 55 to a 56? I'm sorry. It's not good enough. Someone's going to have to say that. I want to be number one. We don't play every year to lose, and this is the same type of energy and effort we need when it comes to health and wellness of the community. So once again, I want to thank everyone for being here and making sure that we can do more to help those that need it. Thank you so much.
Thank you, Mickey. I also want to bring up legislator John Brusso. He is in the Erie County Legislature, and he's going to talk to you a little bit about his efforts to address a new market challenge that we've had in the tobacco fields, and that's vaping. John?
Thanks, Phil. First of all, I'd like to thank Phil and everybody in this room. One thing I've learned about government is there's talkers and there's doers. Well, the people in this room are doers. You're trying to make a difference, and I'm honored to be part of this, whatever position I can take, whatever help I can offer. I'm here to talk about a little bit about adolescent vaping. I'm the vice president of the Kids Escaping Drugs Foundation. It's been my go-to charity for over 20 years, and I've learned about this epidemic, and we're trying to get ahead of that. We've had some community conversations to get that awareness out to people in the area on adolescent vaping. The numbers state that in middle school and early high school, from 3 years ago to today, 60 to 80% increase admitted vaping, okay? The fact is that those folks are vaping, the kids that are vaping, they took something that was an alternative for adults to quit smoking, and it's whittled down to our middle schools. And that's not a good thing. We need to address this and actively attack this. And that's basically one of the things that I'm trying to do by raising that awareness. I say all the time that education and communication are the two most important things in any problem-solving issue. The people in this room are getting some communication out today. Their education, getting everybody rowing in the same direction will take advantage of getting the number from 56 to 53 to 43, and then eventually, in our lifetime, Mick, number one. Super Bowl, the Super Bowl, that's right. So you know that the legislature takes, if you don't know that, the legislature takes a very proactive approach to health and wellness. And actually, their voting record has a track record dating back for years before I even got there on trying to do the right thing. And then we filter it up to the state, and the state implements a lot of the things that the Erie County legislature has done, all right, along with the administration. And that's a both sides tactic, okay? That's not a one side or another. That is a both sides tactic because it's the right thing to do. And you have our commitment that we're going to continue to try to do the right thing. once again, thank you very much, Phil, and everybody in this room for doing what you're doing.
Thank you, John. I want to say that we've put a strong emphasis here on the youth and going upstream with them, but I'm going to ask John Craig to come back up and talk about some of the initiatives that are addressing the health and well-being of our older adults. John?
And again, this is a really good example of really terrific things that have really started to happen in Western New York really within the past couple of years. So we're going to see the fruits of this labor someday, and the sooner the better. But Erie County has an initiative called the Age-Friendly Erie County, and the city of Buffalo is doing something very, very similar. And the idea is very simple, but it's very comprehensive. If you design and create a community that's really targeted to make it easy for senior citizens to live there, it benefits everyone. For a number of ways. And one of the things, if you think about, and it's a simple example, but it's a nice kind of microcosm. If you think about the cutouts in the sidewalk that make it easy for people who maybe are in wheelchairs or people who have walking issues to cross the street, that helps people, senior citizens who might have trouble walking, who are in strollers, but it also helps young families with strollers with babies in them. It also helps maybe young kids who are interested in cycling. The other thing that creating a walkable community does, and there's a lot of data that show this, is it drives economic development. Communities that are thriving are communities where people want to live, and they want to live there because amenities are nearby, shopping is nearby, where they worship, where they go to school, where their friends are, where they socialize. It's all nearby and preferably within walking distance. If you don't believe me, look at what's happening in some of the suburban areas and the malls. They're struggling. You look particularly at areas of Buffalo that are thriving. People want to live by other people. People want to live by other amenities. That's really nice. It's a great development. So hats off to Erie County, the city of Buffalo, and other areas that are developing these age-friendly communities. And it's a little bit of a misnomer because it's not just about senior citizens and older people. But again, if we create a community that's really thriving and vibrant with those older citizens in mind, it benefits everyone. So again, you're going to see a lot of changes in the community in terms of walkability, bikeability, access to walkable amenities. And it's a really, really exciting thing happening in our community. So we'll see more of that. Thanks.
Thank you, John. We often use the phrase quality of life in any community is best measured by the health of its people. And certainly today we're trying to give you evidence of all of the collective efforts that are occurring amongst private, public, and nonprofit and citizen groups. Jackie James Creedon has led for 15 years the efforts to improve the health of the community of Erie County, and particularly the Tonawondas. And I want to ask Jackie just to come up and share a couple of her thoughts about citizen involvement in community initiatives. Jackie?
Phil, you didn't prep me on this. I'm unprepared. I didn't think I was speaking today, but I'll do the best I can. Phil is board president for our community organization called Citizen Science Community Resources. We have a small office center in the Philip Sheridan building in Tonawanda. And what we do is we empower community people, whether they're, the youth or adults or the elderly, with citizen science tools. And these tools test our air, soil, and water for environmental contaminants. And we use that data for change, as we did in Tonawanda when we held Tonawanda Coke accountable for their air pollution. So I'm very encouraged by what I hear today. And one thing that I did want to mention is that what I surmise that is potentially the cause of the ill health of the county is the particulate matter. Our county has been in non-attainment for quite a number of years, and what that means is that they're below the guidelines for what a safe level of this particulate matter is. Particulate matter goes in your lungs and causes heart disease. So I hope that with the work that we do and the work with all of you, that we can make this county a healthier place to live for everyone. Thank you.
Thank you, Jackie. And we're getting close to wrapping up here, so a couple of quick thoughts that I want to share. There's a number of initiatives going on for workplace health promotion. The American Heart Association is doing things. There's an initiative on the Buffalo Niagara Medical Campus. The Population Health Collaborative has a workplace health promotion initiative. We also are ready to tackle winter. The city of Buffalo was awarded one of 3 out of 62 communities to participate in Winter Mission, an initiative of 880 cities out of Toronto to look at how we can turn the tables, if you would, on marketing our community as a Four Seasons wellness destination, and that's another piece that is coming down the road. There are ongoing initiatives. In the background here in the group today is Russ Kingsbury from Youth Advantage. A lot of after-school groups and organizations are working so that when the child comes home, there are opportunities for his or her self-development in a positive and healthy way. So I think if you take all these things collectively together, you can see. But I want John to come up and do a little bit of a dialogue on policy, because we know how important that is to creating positive change in community. And John will do a summary too of a little bit of what you heard, and then we'll entertain any questions from the audience or the media. John?
So the last time I was in the Department of Motor Vehicles, I didn't notice that the unhealthy vending machines were no longer there, and it's because I was in and out so quickly. Yeah, I mean, wow, that was like nothing, and everybody was so friendly and happy. So that's the new Department of Motor Vehicles. But it's a good example of how policies really make the change. So communication and education is absolutely crucial, and you alluded to that, John, and you're absolutely right. But at some level, people know this. People know they should be eating better. But what are the policies? What's kind of the behind-the-scenes work that makes that easier for people? So Phil and I and maybe a few other people remember the day when you could actually buy cigarettes from vending machines. Anybody else remember that? The way that we set up policies creates the environment that people live in, and the environment that they live in directly impacts their behavior. So whether they have access to healthy food, whether they live in a community that's amenable to walking, whether they have access to easy cigarettes, or we make it harder to buy cigarettes with things like taxes and raising the age and getting vending machines out of cigarette vending machines out of places, and not letting drugstores sell cigarettes. All these things, these policies, the kind of behind-the-scenes work that's sometimes a little bit boring and a little bit grinding, but that's what really, really makes a difference. And Erie County, Niagara County, some other counties in this region have really moved forward and with a lot of very, very progressive policies that have helped that. So we're very, very excited by that development. So a real quick summary, and then I think we'll take questions and answers. But it's interesting. We're talking about the health of the population. And I think doctors has been mentioned maybe once the whole time we've been up here, which I think represents a real sea change and a cultural change in how we view people's health. Your doctor does not make you healthy or unhealthy. What you do, living, where you work, where you go to school, everything, all the decisions you make 364 days a year that you're not in your doctor's office, that what determines your health more than anything. The doctors play an absolutely crucial role. And I love my doctor. The doctors are important players. But again, the doctors will, and they are starting to get more involved in all these other things that we're talking about. So again, getting all these important players to the table, getting us all rowing in the same direction, getting us all addressing systems and policies instead of just programs is going to change the kind of results we've been getting in terms of the county health rankings. So we've got good people around the table, and we've got people rowing in this right direction, so we'll get there. So I think that completes the planned part of the program. We'll take questions from anybody who has any. Yeah.
Johnny, I have one for you that you kind of started with. You said, I mean, obviously the reason that we're here today is because Erie County's ranked 56 out of 62, Niagara 58 out of 62. You say those numbers are misleading. Would you mind expanding on that a bit?
Yeah, it's a little bit misleading because a lot of the right things that are going to change those numbers are in place. So misleading is maybe not more unfair than misleading. The types of things, if you dig a little bit in the data that are measured, but for the county health rankings, are things that will be impacted over the long term. So it will take a long time before you see things like obesity and diabetes change because of the kind of grinding policy work that some great community leaders are doing. So it's like people are doing the right things but not getting rewarded or recognized for it. And that's one of the reasons we're here today.
The other question I had for you, our neighbors in Wyoming County are ranked
Yeah, and Phil said this. Your zip code determines your health. That's a big measure. And if you look in Erie County, and frankly, some of the lower income areas in rural counties, you can see that people just don't have access. And where there's poverty, there's poor health. Wyoming County has some of that. They have some of their own challenges around other health issues. Mental health is one of them. But there's some good progressive leadership in Wyoming County that's doing a lot of terrific things, and some of what they're doing can be models for what the rest of us are doing. But we don't want to beat up anybody in some of the other counties where we have higher levels of poverty, because it's a real uphill battle. But hats off to Wyoming County, no question. To tell you the truth, I'm not sure what the poverty rates in Wyoming County. I know there's pockets of poverty there too, but some of the really grueling poverty we have in areas in Buffalo, and again some of the outlying rural areas, really add to the challenge. Yeah, Phil, please, and anybody.
Yeah, sure. One of the resources that we have in the community that has evolved that could address that issue is that we now have 10 of our 23 colleges have from 2-year to PhD health and wellness degree programs. For example, this neighborhood that you're in here today for the press conference is called the Hooks neighborhood. It's historical. And we're working with the School of Planning and Architecture with stakeholders in this community, including Channel 7, to try to improve the walkability of this community. So tapping our university assets to answer some of those questions are great research opportunities for the students and the faculty and staff there, and have a benefit to the community. The other small thing is we're not suggesting that everybody move to Wyoming County, but that's another option in that framework. Any other questions from anybody? Yeah, if you go to their website, you can get the in-depth look. And we've been fans of them for 10 years. We worked with them prior to that with the Buffalo Niagara Medical Campus to improve walkability and active living on the campus. And it's evolved. Again, you've heard some of the people here talk about, they're looking at some of the social determinants of health, the poverty. Poverty is not just economic poverty, it can be health poverty, and et cetera. So if you look deeper into what they're looking at, you can get a feel county by county. They have it broken down. We do, at least I know I looked at Erie County last night, we do a little better there in health behaviors. I think we're in the mid-30s there. So being at it for 10 years, being very academically oriented, the Population Health Institute that is contracted by Robert Wood Johnson to do this has constantly improved the metrics that they provide for communities and the coaching and support that they can offer them for positive change. So I would encourage anybody that hasn't had a chance to visit that site to get a more in-depth look and answer that question a little more finely. Any?
Yeah, and frankly, that's what gets me really, really geeked up, to be honest with you, and I really am. We have silos, so education is where kids go to school is a huge part of impacting their health. Where people work is a huge part of people's health. There are probably, I could probably rattle off 20 programs in Western New York that are trying to address obesity, but they're all doing it in different ways, and they're all doing it alone, and they're all doing it with different measures. Some of them are evidence-based, some of them aren't. Some of them are they're all well-intentioned, but we don't know what the outcomes are. If all of those organizations got together that were trying to address obesity with each other, and then also got together with school systems and employers and economic development agencies and government leaders, if everybody agreed to, this is what the evidence says works, these are the measures that really drive change, and we're all going to work together in the same way with the same language and the same metrics, that's the type of systems change that frankly we're just starting to pull together now. So that's really a good example. It's just, it's a cliche, and I apologize for the cliche, but we really have to break down the silos. And right now, everybody's doing everything in a silo. I shouldn't say everyone. Too many people are doing things in silos. We need to break them down completely and have all these different sectors, all these really smart, well-intentioned people agreeing to the same thing to make the systems change.
Can I add something to
Yeah,
that? Very quickly, I'd like to add something. Also, what brings to forefront when you say that is that a lot of the programs, they target behaviors, right? Stop doing this, don't do that, do this better. But the systems part is what we alluded to earlier, saying that, okay, eat better, but if I live in an area that the food that is better is unaffordable, how does that help me? And so part of the systems change is how the system reacts to the people who live in the area. So I just wanted to make that clear also, that we have to change as providers, as organizers, as organizations, how we interact with the people who are receiving the help we're coming into, and have their voice amplified. If they say, this doesn't work for me, our systems need to reflect their realities. And so when I think of systems change, I think of that too, not just how we work together, but what we're offering to our community.
I do not believe that addiction to anything is a good thing at an adolescent level. And the problem is the levels of nicotine in these products are giving them a sensation, and they can do that right in the classroom. Okay? The teachers don't even realize, you know, the big plumes of smoke of vape that comes out of the old models are not there anymore. These things look like a flash drive, and they need to be charged up. They get charged up into your laptop, which all kids have in the schools now, and they take that, they can take a hit off of that, and then they can actually blow it into a hoodie or anything like that, exhale into that, and you will not know. And not only is it tobacco in the high levels, companies like Juul, okay, have pods that have 65 milligrams of nicotine in it. 65 milligrams of nicotine. I met with a vape shop owner to talk to him about what to do. And he said, I've been a 30-year smoker. I'm now a 5-year vapor, okay? And I do 3 milligrams of nicotine a day. So now figure a pod with 65 milligrams of nicotine in it, and figure a student going through 2, 3, 4 pods a day sometimes. Bad deal. Real bad deal. So we need to be proactive about this. Again, somehow it got messed up that a good tool to give adults an alternative of a safer way to curb their nicotine addiction has turned into this. And that is, like I said, a bad deal, and that's why I'm happy to be in the forefront of trying to raise that awareness.
Anything else from anybody? Well, if not, we want to thank you all for being here today, particularly the media. You are essential to helping us to get the word out and educate people, and I want to recognize all the folks here and my staff from the Institute, and a big shout out to WNED for hosting us today. Stay tuned, more to come, and if you're interested in getting involved, please feel free to contact either John Craig or myself. We're always looking for more partners and opportunities to share lessons learned. Thank you and have a great day.